Good morning, ladies and gentlemen. UroLift. BPH affects all older men. At age 30, about 5% of men may have some BPH. When you reach my age, around 50, maybe 25% of men will have this problem. When it comes to 70, around 70% of men will have it. It's an extremely pervasive problem, and it causes significant issues. And we're here today to learn about a new treatment that will change BPH management permanently. Now, we know that the current treatments for BPH have problems. They work by relaxing the bladder neck or removing prostate tissue. Drugs relax the muscles. Surgery, such as TURP or HoLEP, physically removes the bladder neck. And this improves the urinary flow naturally, but at the same time it causes retrograde ejaculation. But most men want to have urinary symptom relief and normal sexual function. They do not wish to have no ejaculation on orgasm. And so I'd like to present to you the UroLift, which both relieves symptoms and preserves sexual function. Now, how does normal ejaculation work? Well, if you watch this video, I'll show you. Here we have the bladder on the left. There is the prostate gland. Now, as orgasm occurs, the urethra relaxes, and this allows semen to enter it, and it's then passed out. Now, the reason the semen doesn't enter the bladder is because the bladder muscles contract, so preventing semen from going into the bladder. If we damage the bladder neck, on an orgasm, semen enters the bladder and it's voided the next time urination occurs. So the UroLift system is designed to prevent this problem. It comprises an implant which is put through the prostate lobes. It has a special thread with metal ends, nitinol and stainless steel, and is a bespoke delivery device which passes through normal cystoscope. And the UroLift technique is demonstrated here. A cystoscopy is performed and the obstructing prostate lobes are seen here. Here is a front view over the top, and you can see there's a narrow channel. A cystoscope is placed inside and the device deployed. A needle passes through the prostatic urethra, the lobe of the prostate, to the outer capsule. This pulls the inside to the outside, so compressing the prostate lobe. You can see it's far away from the bladder neck. It's actually in the prostate tissue itself, so the bladder neck muscle is not affected. The same procedure is performed on the other side, and when it's performed on both sides, the lumen between the lobes becomes bigger. The number of implants varies between 2, 4, 6, potentially 8. Now, what's good about this is this technique that has virtually no bleeding. It can be done as a day case, so the patients can go home the same day, and it can also be done under local anaesthesia for those patients willing to have it done that way. You can see here before what the prostate looked like and thereafter. Here's the front view, and you can see the lobes are pulled apart. And on a cystoscopic view, you can see there's a nice lumen appearing there. Now, what about symptom relief? Well, we know that both voiding and storage urinary symptoms are relieved. This means that storage symptoms like nocturia, frequency get better. So men will get a good night's sleep when they didn't get that before. And also, when they pass urine, it's less difficult, it's faster, and there are few problems. And we see those symptoms are relieved very early. It occurs within a few weeks of having the implant deployed, and it lasts for at least 3 years, and there's no evidence of attrition over time. What's more is that the quality of life and the recovery it comes back faster after a UroLift than a traditional TURP. Here's a graph for over 12 months, and you can see that the recovery after UroLift is within within 1 month or so, compared to many months after TURP. So patients get a faster benefit as well than compared to conventional surgery. Most importantly, sexual function is preserved. And again, if you compare it to a TURP, where it goes down after the procedure, it actually goes up after the procedure for men having had a UroLift, which is actually a benefit. And the side effects are also much less. So as you'd expect, there might be some dysuria compared to, say, a cystoscopy, but nothing more than a TURP. Obviously, there may be some blood in the urine transiently, and there may be some pelvic pain for a short period, but mostly it's well tolerated. There's a small theoretical risk of incrustation, but that occurs uncommonly. NICE evaluated this procedure recently, and it produced another medical technology guidance on the 16th of September this year. And this is what they said. They said that the clinical case for adopting the UroLift system for the relief of urinary symptoms is supported by evidence. The UroLift system relieves lower urinary tract symptoms whilst avoiding the risk to sexual function associated with TURP or HOLEP. It can also be done as day surgery. So this has been given the stamp of approval by an official regulatory body in this country and is approved by the insurance companies. UroLift fits well in the existing pathway. So if you have a man who comes in with urinary symptoms due to BPH, if ejaculation is important, you might give malthusisin. If it's not important, tamsulosin works as well, but does have the side effect of retrograde ejaculation. If they're still bothered, despite alpha blockers, then you need to consider a surgical option. And the UroLift is applied to virtually all prostates, providing they're less than 100 grams in size. Beyond that size, it becomes untenable. And similarly, if there's a median lobe, it's preferable to do a HOLEP. But for the vast majority of prostates, a UroLift is applicable. So in conclusion, the UroLift procedure has been shown to be an effective way of treating urinary symptoms. It both improves the flow and preserves sexual function. It can be done as a day case and no catheter is required. Patients return quickly back to work and can have sex as they did before. Thank you very much for listening.